The COVID-19 vaccination drive, which began in February, has to date seen over 40,000 persons, including frontline healthcare workers and the elderly population, being inoculated. Last week, citizens over the age of 40 also began receiving the jabs. Even as the government ramps up the drive to possibly vaccinate its way out of the pandemic, Danuka Radzik, a director on the Board of Help and Shelter, is of the view that the vaccine is not equally available to all. Radzik, who shared this view during a Zoom interview with 90 News on Wednesday, expressed that she has found that help and shelter, though essential, has not been recognized in the present vaccination drive.
Right, so we consider ourselves our essential service, but we haven't really received the kind of same kind of protection and protocols and stuff like that other services may be enjoying.
Radzik opined that Guyana is one of the only countries that does not consider shelter services as essential, even though these facilities house high-risk persons.
In some other countries, shelters and so on are considered essential services. So I think it's good to sometimes classify them as such because, these people are high-risk people.
As such, she opined that the ministry should be taking its vaccines to shelters the way it did to the inpatient homes for the elderly.
Shelters and so on, they are really essential services. These people have nowhere else to go. And therefore, they should maybe be given some priority in relation to vaccinations.
Highlighting the seriousness of the coronavirus, Radzik stated that as the safe houses continue to receive persons, it increases the likelihood of there being an outbreak. As such, it was expressed that the organization will be exploring available options to allow those residing at the safe houses to access vaccinations. Launched on November 26, 1995, Help and Shelter is a non-governmental organization which was formed as a response to the high incidence of violence, alcoholism, and poverty in Guyana. Over the years, the organization has provided the much-needed support to victims who wished to leave abusive relationship and unstable families through counseling and crisis services. Reporting for the AGP Nightly News, Kendell Richmond.